are often said to have a different thinking ability, and often women are blamed for overthinking anything and everything. Men and women do think differently, at least where the anatomy of the brain is concerned. However, physical activity has a huge impact. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and today I'm going to discuss about how physical activities impact thinking in men and women. Studies have shown that physical and mental activity help preserve thinking skills and delay dementia. A new study suggests that these benefits may vary for men and women. The study was published in July 20th, 2022, online issue of Neurology, the medical journal of the American Academy of Neurology. The study looked at the effects of physical and mental activities such as reading, going to classes, or playing cards or games on cognitive reserve in the areas of thinking, speed, and memory. Cognitive reserve is the buffer that occurs when people have strong thinking skills, even when their brains show signs of the underlying changes associated with cognitive impairment and dementia. The study involved 758 people with an average age of 76 years. Some had no thinking or memory problems, some had mild cognitive impairment, and some had dementia. The participants had brain scars and took thinking, speed, and memory tests. To calculate cognitive reserve, people's thinking test scores were compared against the changes in the brain associated with dementia, such as the total volume of the hippocampus, a key brain region impacted by Alzheimer's disease. People were also asked about their usual weekly physical activity. For mental activity, they were asked whether they participated in 3 types of activities in the past 13 months, that is, reading magazines, newspapers, or books, going to classes, and playing card games or bingo. They were given 1 point for each type of activity for a maximum of 3 points. For mental activity, participants averaged 1.4 points. For physical activity, participants took in an average of at least 15 minutes per week of activities that elevated heart rates, such as brisk walking and biking. Researchers also looked at whether the relationship between physical and mental activities and cognitive reserve was affected by the gene that carries the strongest risk for Alzheimer's, called APOE epsilon 4. They found that for women, having the gene lessens the effects of the beneficial relationship between physical and mental activities and cognitive reserve. The study does not prove that physical and mental activities help improve cognitive reserve. It only shows an association between the two. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.